What if I told you that something sitting quietly on your breakfast table, something you've trusted is healthy for years, could be slowly inflaming and enlarging your prostate without a single warning sign until the damage feels irreversible? No pain, no abnormal blood tests, no red flags on routine exams. Yet night after night, you wake up to urinate. Your urine flow weakens. You feel like your bladder never fully empties, and you're told it's just age, it's normal. But what if it's not? Hello, my friends. I'm Doctor, urologist and prostate health specialist, and today we're having one of the most urgent and potentially life-changing conversations every man over 40 needs to hear. Because after years of clinical practice, I can tell you this with confidence. Prostate enlargement is not simply an unavoidable part of aging. In many men, it's driven by chronic inflammation triggered by specific everyday foods, including fruits most people believe are harmless or even beneficial. And that's exactly what we're exposing today. Before I dive deep into this critical medical information, make sure you like this video, subscribe, and press the notification bell so you never miss evidence-based guidance that could protect your prostate and your quality of life. Welcome to Urology for You, where prevention comes before prescriptions. Every week, men sit across from me in my clinic with the same story. Doctor, I wake up 3, 4, sometimes 5 times a night to urinate. My urine stream feels weaker than it used to. I feel pressure, fullness, but all my tests come back normal. They're told they have benign prostatic enlargement, normal for their age, and are offered medication or told to wait. But here's what's rarely investigated, what they're eating every single day, because inflammation doesn't always show up clearly on early scans or blood work. It builds silently year after year until symptoms finally demand attention. And in my clinical observation, 3 specific fruits are responsible for chronic prostate inflammation in a large percentage of men who consume them regularly. Not occasionally, not once in a while, but daily habitual intake. Let's talk about them. Starting with the most underestimated of all, destructive fruit. Number 1, dried fruits, dates, figs, raisins. Dried fruits are marketed as the perfect healthy snack. Natural, portable, nutrient-dense, but for the prostate, they can be metabolically devastating. Why dried fruits damage the prostate? When fruit is dried, water is removed, but sugar becomes dangerously concentrated. One single date can contain 15-18 g of sugar. A small handful can spike blood sugar faster than many desserts. Mechanism 1, insulin-driven inflammation. Repeated sugar spikes force the body to release large amounts of insulin. Chronically elevated insulin stimulates inflammatory cytokines that specifically target hormone-sensitive tissues, including the prostate. Men with prolonged insulin elevation show dramatically higher rates of prostate enlargement. Mechanism 2, IGF-1 and cell overgrowth. High insulin raises insulin-like growth factor 1, IGF-1, a hormone that directly stimulates prostate cell proliferation. In simple terms, you are feeding prostate growth at the cellular level. Mechanism 3, advanced glycation. End products, AGEs, concentrated sugars bind to proteins forming AGEs, highly inflammatory compounds that damage prostate tissue, worsen oxidative stress, and accelerate enlargement. These compounds accumulate silently over years. Mechanism 4, crowding out protective foods. Men who snack on dried fruits often consume fewer foods that protect the prostate, like cruciferous vegetables, omega-3 fats, zinc-rich proteins, and lycopene-containing tomatoes. A 58-year-old patient came to me exhausted and frustrated. Nighttime urination 5 to 6 times, weak flow, constant bladder pressure. His diet sounded healthy until we looked closely. Every day ate 10 dates, raisins at breakfast, dried figs as snacks. He was consuming over 130 grams of sugar daily from dried fruits alone. We eliminated dried fruits completely. Within 3 weeks, night urination dropped in half. Within 6 weeks, urine flow improved. Within 3 months, waking only once per night. Nothing magical happened. We simply stopped inflaming his prostate every day. Destructive fruit. Number 2, citrus juices, orange and grapefruit juice. Fresh orange juice feels wholesome, refreshing, natural, packed with vitamin C. But from a urological perspective, daily citrus juice is one of the most prostate irritating habits I see. Why citrus juice harms prostate health mechanism. 1, liquid sugar without fiber. Juicing removes fiber, the very thing that slows sugar absorption. 1 glass of juice, sugar from 3-4 oranges absorbed in minutes. That rapid spike triggers insulin and inflammation, again targeting prostate tissue. Mechanism 2, chemical irritation. High concentrations of citric acid can irritate the prostatic urethra and bladder neck, worsening urgency, frequency, and discomfort. Mechanism 3, zinc disruption. Excess citrus can impair zinc absorption. Zinc is one of the most critical anti-inflammatory minerals for the prostate. Low zinc unchecked inflammation. Mechanism 4, estrogen shift. Excess fructose is converted to visceral fat. Visceral fat produces aromatase, an enzyme that converts testosterone into estrogen. An elevated estrogen to testosterone ratio strongly promotes prostate enlargement. Clinical example: a 52-year-old man drank fresh squeezed orange juice every morning for years. Despite exercise and healthy eating, his prostate symptoms worsened. We eliminated juice completely, replaced it with water, limited whole citrus to small portions, increased zinc intake. Within 8 weeks, his nighttime urination dropped from 4 times to once or twice. Destructive fruit. Number 3, high sugar tropical fruits. Pineapple, mango, papaya. When consumed frequently, tropical fruits are praised worldwide for their vitamins, enzymes, and antioxidants. But for prostate health, quantity and frequency matter far more than reputation. Why tropical fruits can inflame the prostate mechanism. 1. High glycemic load plus enzymatic activity. Many tropical fruits contain large amounts of sugar combined with active enzymes like bromelain. In sensitive men, this combination increases intestinal permeability, allows inflammatory compounds into circulation, directly aggravates prostate tissue. Mechanism 2, fructose overload. Fructose is processed exclusively by the liver. Excess amounts convert rapidly into visceral fat and inflammatory byproducts. These inflammatory signals don't stay in the liver. They circulate and target hormone-sensitive organs like the prostate. Mechanism 3, displacement of protective vegetables. Men who rely heavily on sweet fruits often consume fewer cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, kale. These vegetables contain sulforaphane and indole-3 carbinol, powerful compounds that suppress prostate inflammation and abnormal cell growth. A 48-year-old man living in a tropical region noticed his prostate symptoms worsen every fruit season. When tropical fruits were removed completely and replaced with vegetables and omega-3 fats, his symptoms improved dramatically even during peak fruit availability. Warning signs: your prostate is already inflamed, increasing nighttime urination, weak or hesitant urine stream, sensation of incomplete emptying, sudden urinary urgency, pelvic or lower back discomfort. These are not normal aging, they are signals of inflammation. The Prostate Reset Protocol. Step 1. Eliminate all 3 fruit categories for 60-90 days. Remove dried fruits, citrus juices, high sugar tropical fruits. Step 2. Replace with low sugar berries, blueberries, raspberries, strawberries, limited portions. Step 3. Prioritize cruciferous vegetables. These actively suppress prostate inflammation. Step 4. Optimize zinc and omega-3s. Pumpkin seeds, fatty fish, quality proteins. Step 5. Smart hydration. 2 to 3 liters of water daily. Cut fluids 3 hours before bed. What most men experience after 4 to 6 weeks: fewer nighttime bathroom trips, stronger urine flow, reduced urgency, better sleep, improved hormonal balance. If you're waking up 2 or more times per night, do not ignore it. Every day of continued inflammation increases the risk of permanent enlargement. The prostate has an incredible ability to recover when you stop attacking it daily. Thank you for watching Urology for You. If this video helped you, like it, share it, and subscribe, because the right information at the right time can change your life. For persistent or severe symptoms, always consult a qualified professional.